Hello world, we are here at Estate Park, Colorado, and we are going to hear about the highlights of the day.
Yeah, hi. So my name is Roland Regoes. I'm from Zurich, and I'm a mathematical biologist who is interested in virology and immunology, and also in bacterial infections. Yes.
Okay, hi. My name is Bauchemin. I'm originally from Montreal, Canada, but now I'm working as a professor of physics at Ryerson University in Toronto, and also at the Riken Institute near Tokyo in Japan. I do virophysics, as I like to call it, so it's mostly analyzing in vitro data. My interest has always been in vitro data of virus infections, and mostly I've worked on influenza, but also a little bit on the respiratory syncytial virus and HIV and HCV, and yeah.
So what do you like about studying in vitro data?
It's clean. So I feel that whenever you go in vivo, either the data is insufficient or the parameters cannot be identified because you're measuring too little for the complexity of the model. You always have to make assumptions, and you're never quite comfortable or sure about the assumptions. So in vitro, I can control the system. I can analyze. There's a fewer number of variables, so you can know that you got it right. And we can even now, we're at a stage where, and most people say you can't do that in virology, but we're at a place where we can predict the outcome of an experiment. We can predict quantitatively the time course of the experiment and actually get it right without having to fit at all. So it's a good place to be, and it's certainly impossible at this point in vivo, but I keep my hopes up that if we can resolve a lot of questions in vitro, we should be able to translate at least some of it in vivo and start breaking down the fact that we have this problem of too little data and too many parameters. If we can resolve some questions in vitro, then maybe we can use that to now clarify the in vivo problem.
On the balance between the data and the models, that might just require simpler models, reducing the complexity of the model.
And that's a strategy that a lot of people do end up adopting. But when you simplify a model, it depends on the question you're asking, of course. But whenever you simplify a model, it can actually introduce bias. It can actually introduce misinterpretation of the data. And so you think you think that's how it is, and then you find that it isn't, right? And that certainly has happened with HIV. For a long time, they felt that they had identified the viral clearance rate, the clearance rate, the rate at which the HIV virus clears out of the blood, and then in the end, they introduced new drugs that were better, and then suddenly they saw that the clearance rate was almost 10 times bigger than what they had estimated, right? And that had an impact also on the estimation of the rate at which viruses produce, which then has an impact on the rate at which resistance can emerge. So I think all models are simplification ultimately.
Yeah.
But I think there can be consequence, and it's important to keep that in mind, that we always do our best and we do the model that we can given the data that we have. But we're also always making assumption, and we're always vulnerable in these areas. And I feel that in vitro, that's often less of a problem. So.
What's your views on that, Roland?
Yeah, so I actually agree that it's cleaner data in vitro. But we have been working on also animal models and also epidemiological data, clinical data. And obviously it depends on the type of questions you're asking.
That's
so
right.
As a compromise between, say, tidiness and relevance, I actually prefer animal models, especially if you're interested in the dynamics in the host, within the host, then animal models are very, very valuable. Usually clinical data, except for HIV, it's hard to do dynamical studies. So I think you can address epidemiological questions or maybe also evolutionary questions on a population scale. But I think animal models are best for the topic of this conference, which is about viral dynamics.
So what's your highlights of the day?
So what I thought that the entire session was actually quite inspiring. What intrigued me quite a bit generally over all the talks is to what degree people relied on concepts that came from ecology or evolutionary biology. So we have been hearing, for example, about the Ali effect, about rarefaction curves, which I think are very valuable tools, and people are using them more and more to understand these immunological and virological systems. So the talk on which was about Ali effects, I found really very interesting, because it also used stochastic models, looking at the bursts that come out of cells in vitro, and they try to understand this relationship between the activation of latently infected cells and the establishment of an infection. So I found that actually quite elegant also theoretically, because that's one of the things why people might also not like very simple models, that you are, as a theoretician, you are not necessarily satisfied. So here I think they identified something actually quite nice. The other thing I enjoyed very much, because it's also very close to what I'm interested in, was this last talk on transmission founder viruses versus founder strains. I'm very happy that some people are tackling this problem, or this conflict between the early population dynamics and the early population genetics of HIV infection. This is actually a very nice link also between the within host dynamics and the epidemiology.
Yeah, definitely. Yeah. How about you?
I don't have a whole lot to add. He's basically covered it mostly. But I would say that for me, I enjoyed all the talks, I would say. I think the idea of this latent reservoir is very interesting. And I mean, there's a distinction between an eclipse phase, so the time from the time the cell is infected to the time it starts to produce virus, because during that time what's happening is the viral replication mechanisms are being put in place. And then there's the counter of that, which is basically the latent phase, which is when, in fact, the virus has colonized the cell, but it didn't result in actual viral production, it just resulted in latency. And I think there's a lot of different ideas, and I'm kind of looking forward. I mean, almost the entire day has been devoted to this, figuring out that latent reservoir. I was kind of amused by one speaker who said, we will never be able to solve the latency problem. And I thought, well, that's very short-sighted, because in influenza we had the same thing, that there will never be drug resistance to Tamiflu. And of course, we did end up with resistance to Tamiflu. So I think saying never in health research is never safe. That's the one never you can say. It's never safe to say never. But I think there's a lot of it's progressing very well. It's very well understood now what the issue is. Solving it, I'm confident, is within reach, but not yet. So I like that. Different people brought different perspective of all the different angles of that same problem, so I like that.
But how does it relate to your current research on influenza?
Does not. So, I mean, I don't think it does, because I don't think there is a case of latency in influenza. Of course, you can never know, but there's a big difference, and that also comes back to the idea of in vitro versus in vivo. The fantastic thing about chronic infection, and I'm saying fantastic not from a human perspective, but from a modeler's perspective, like as an interesting system, is that a chronic infection system is more possible to study in vivo, because you have this steady state equilibrium and you can make certain assumptions and then you can perturb the equilibrium. In an acute infection, there's so many things that are still ramping out, stuff that's starting to collapse itself, and every single variable is changing at the same time. So trying to extract all these parameters is much more challenging in an acute phase of an infection than in a chronic steady state. And so a disease like influenza, I mean, I've done reviews after reviews of in vivo model of influenza showing that the model did not do anything, did not identify anything, and was in fact fundamentally flawed, because while it could fit perfectly the one data set they had in their paper, other people also perfectly fitted their data in their paper. If you try to use one model to fit the data of another paper, and even if you allow the parameters to change, you cannot reproduce. Or if you do knockout experiments, so they say they will have established because the immune response is very important, in fact, in influenza. You can't assume that it's steady state. You can't assume, because it's an acute infection. It's not there at the start, it ramps up at the end, and it's critical for clearance of the infection. So all these different models, you can do knockouts, and they all predict different things if you knock out antibodies or if you knock out T cells. So in influenza, the idea of modeling an in vivo infection has been, I would say, plagued with issues, which is not as true for HIV, not as true for HCV, because of that chronic. Like the chronic infections have an easier life in vivo than the acute infections. So that also shapes my my thinking.
Yeah, I myself, I haven't worked on latency in HIV myself, but I think there are parallels in bacterial infections, and I think the bigger issue is that you have heterogeneities in how well you can reach certain pathogens and kill them. So in bacterial infections, there's this phenomenon of persistence, where if you expose bacteria, they first decline exponentially, but then this exponential decline flattens out, very similar to what you have in HIV infection after treatment. And this in bacterial systems is already something you see in vitro. There's all kinds of theories about what the relevance of that might be also clinically. And I see some parallels, although obviously the molecular mechanisms are very, very different, but in terms of the modeling, it's quite similar. So I think the latency issue is something where the HIV field is probably also leading the quantitative understanding and how to deal with it. But I think it transcends HIV.
Yeah.
All right. Now we're going to move to another section, and this section is dedicated to encourage and motivate young researchers. So my first question would be, what do you like about your job?
Oh, everything. I like everything about my job, I think. I mean, it's what you want to do when you're a kid. Well, people who end up doing what I do, usually as kids, they love puzzles. They love solving puzzles. And I think, so because my formal training is in physics, my basic interest when I went through school and when I ended up where I am now, but before that in physics, was that I want to know how the universe works. And I thought it was amazing that you actually could know how the universe worked. That was mind-blowing for me. And because I was good at math, it just kind of naturally worked out. And then I got very curious about, at first, artificial intelligence, and then I realized that the immune system exhibits a lot of the properties of an artificially intelligent system. And so then I thought, well, not artificial intelligence, but distributed intelligence. So then I got interested in that, and then from one thing to another, I ended up in naming my field virophysics, and that was partly because of grant money. So in physics, everything is very narrowly defined. A biophysicist, a lot of time it's about energy landscape and molecule folding and stuff like that. There's a very traditional view of what biophysicists should do. And then there's medical physicists, and they only work on cancer visualization, cancer therapy. So if I'm working in virus and I'm a physicist, I've had to be very apologetic about what I am, because the biophysicists don't see me as one of them, the medical physicists don't see me as one of them, and if you're applying for funding, both of them feel like you're taking money out of their field. So I decided if I just create a new name for it, then maybe I can sell it, and it's worked. So that's how it's worked for me. But the point is, it is fascinating to try and understand how the viruses work. I'm not a particularly altruistic people. Some people will say, oh, it's so nice that you're applying your knowledge to, help people. But it's for me, it's never been about helping people. It's always been about solving the puzzle. Like, helping people is maybe an accidental consequence, but figuring out what that virus is doing is my biggest curiosity. And maybe that also drives why my interest is so much in vitro, like trying to solve the puzzle more so than trying to find a concrete application for people. I find that that's maybe a side effect.
All right.
But yeah, that's what I enjoy the most, is solving the puzzle.
How about you?
No, I agree. Solving the puzzle is a great aspect. And I think generally there is a lot of freedom in science. You can determine yourself in which direction you go. You can work independently. You can actually drive your entire agenda. You can build up somehow your own map of what you want to find out and where to go. And this is something that is, I think, quite exceptional in science. There's not many other fields where you can do this. So I think there might be some people who don't mind helping others.
There might be.
So you can do that too. You can do that too. And you can work on your own. You can work in teams. You can construct big collaborations. So I think that's one of the great things, and that also gives you a lot of impetus. It gives you a lot of energy to work in certain directions that you determine yourself. I think that's one of the biggest advantages of being in our being in science generally.
Yes, it's an advantage, but it can be quite challenging.
Oh gosh, I totally have an answer for that one. I think as a physicist coming to health research, it's a big culture shock. So in physics, we care a lot about uncertainty, variability, parameter evaluation and stuff like that. And I think in health research, I would say that, I'm going to say this as carefully as I can, the standards of statistics are not always as rigorous as they could or should be. It is a lot of people will say, well, it's a much more stochastic system, there's a lot more variables that we cannot control, and that is true, but there is an approach you can take. Like, a lot of time I find that the data sets that we get, the uncertainty is underestimated, because maybe it will only be the uncertainty of the measurement, not the uncertainty of repeating the experiment several times. And so I find that in health research, the data is not always conducive to doing the analysis. Sometimes you can do the analysis, but you know the data is flawed, and it's very frustrating. So for me, when I compare, so my partner is also a physicist, and he works in gravitational wave detection. And here they are having their data accurate to the 10th decimal place. Now, what a health researcher will tell you is that you can never get that accuracy in health research. But I think it's not true. I think it depends on what you're measuring and what variables you're controlling. And because we have not a very good sense of how many variables there are, we're having a very hard time finding that control. And that's where my interest is in having a very reduced system with very few parameters that we know we can control, and seeing whether we can, in fact, get a grip. Because if we understand what the problem is, we can now start getting that accuracy. Until you have a very simple system you fully understand, you cannot hope to get to that 10 decimal place accuracy. But I am convinced, and a lot of people don't believe that, but I feel very convinced, very strongly, that you can get the same accuracy with a health research system, like a virus infection system, that you can in gravitational wave detection. But that's usually the frustrating part, is the variability and the noise in the data and the type of experiments people do. And what you can do with that data sometimes. There's a lot of limitation, and that's why we eventually got involved even designing experiments. We'll say, like, how about you measure it this way? How about you do this and you do that? This is how many data points we'll need. So even fake experiments with our model to try and understand what set of experiments could they do that would provide us all the data we would need. So that's that's a big one.
Yeah, so I personally never found it too difficult to develop this agenda, because it was also not necessarily something that you have to do completely independently without looking at what other people do. So you start by just trying to understand an interesting article, and from that, the deeper you dig in, the more you find that there is open ends that you might look at. And if you do something for long enough, it will become kind of your own anyway. You don't have to worry about making it original or putting your signature onto it or something. That just happens anyway, I think. Yeah. And this is the great thing about science, is that you can pick any article. You can actually pick any person to collaborate with, and then you can follow your interests.
So what have been your experience on collaboration? Was it easy to collaborate? Did you have some challenges, or what are your best stories of successful collaboration?
For me, I have to say I've been extremely lucky. So coming from Alan Perlson's lab, he already has a lot of collaborators, and he does delegate a lot of his work. So you'll have many collaborators, many projects, and oftentimes he has more projects on his plate than he has people he can give them to. But oftentimes he really does trust you with the work, and you end up with that project. So that was my postdoc advisor, was Alan. And so I got that data, and I got these collaborators, and I got to keep them once I left. And from that, you understand what you can offer to these people. You can understand how to interact with them. And then from that point on, because of the type of data we were doing, I started having people come to me instead. And so I've not really actively, since being a postdoc, I've not ever had to actively go after collaborators. Oftentimes they've come to me because they thought, well, what you did with that virus would be very useful to us in this other context, or could you do it to more strains and stuff like that. So it's kind of emerged somewhat naturally. So I've been very spoiled, I think. I don't know how typical it is, but it's been very good to me, and so it's worked quite smoothly. And I've had experimental collaborators, but I've also had drug companies come to me with very specific questions they wanted solved, and that's been very fun as well, for completely different reasons.
I also had generally quite good experiences.
This is the end of the podcast. Thank you very much for your time, and enjoy the rest of the conference.